All right, well, we might have a few others slowly joining, but I'll go ahead and kick things off since my clock says 12:30. So thank you all for being here today. My name is Jessica Klein. I'm a policy associate with the Kentucky Center for Economic Policy. And this is the safety net session. So if you're in the right room, that's what we'll be talking about today. And I'm going to get started by just providing a brief background on the safety net. We will then go to our panelists for a few presentations and then followed by a Q&A section. So if you do have questions throughout the presentations today, feel free to use that Q&A box to enter your questions throughout the conversation. We'll make sure that we get to those questions. Also, comments and questions are welcomed in the chat as well if you'd like to be part of a conversation. So feel free to use that throughout this conversation. But I'm going to go ahead and get us started with a little bit of background. Just wanted to provide some context for Kentucky's safety net policy landscape. And really, I'm just going to talk about the past few years specifically, but know that this is really preceded by a long history of broad attempts to cut all of our safety net programs, including food, health, cash, and jobless benefits. So for example, in 2019, there was a broad attempt known as House Bill 3 that would have added many expensive layers of administrative oversight, complicated reporting requirements that would cause many Kentuckians to lose assistance. And that included food assistance through the Supplemental Nutrition Assistance Program, or SNAP, cash assistance through the Temporary Assistance for Needy Families Program, also known as TANF, and health assistance through Medicaid. And just a few examples of what that looked like. It would have codified work reporting requirements and different barriers for Medicaid. It would have required unpaid internships, essentially, for parents receiving food assistance, IDs for SNAP and TANF programs, and making benefits contingent on costly drug testing. So luckily that was defeated, but the very next year, we saw House Bill 1 in 2020. And that made sweeping changes as well, or would have if it had passed. Luckily, it was defeated, to public assistance programs. And that would have included 3 new lifetime bans, banning people from programs that help with groceries, childcare, medical bills, and cash assistance. And in that policy, we saw several changes that would have banned people from Medicaid and from SNAP, and again, the cash assistance program known as TANF. Most recently, in 2021, our legislature actually passed a bill known as Senate Bill 65, which banned parents behind on child support from receiving food assistance through SNAP. And when a similar policy was in place between 2018 and 2020, we know that it removed over 14,000 Kentucky families from food assistance. So these are just a few examples in the last few years of some of the attacks that we've seen to our safety net. And through all of these attacks, Kentucky Policy has worked closely with our partners, particularly through the Thrive Kentucky campaign, to work towards a safety net that really supports Kentuckians when they need it and gets them the assistance they need through these programs. So we know that we're all one lost job or a new family member away from qualifying for these types of programs. And I think that the pandemic has really highlighted that we are all very close to that need. So despite these efforts and the proven benefits of safety net programs and what they provide for families and communities, we do expect additional attempts to cut these benefits and create additional barriers for them. And that's why it's so important to have conversations like the one we're about to have today to really understand the impacts of these policies and what these different programs provide in terms of supports for Kentuckians. So today we're going to hear from some national and state experts on the most up-to-date data on these programs that impact health and economic security. So that's going to include food assistance and jobless benefits, as well as the state of work. So we're also going to hear about some of the policy changes we've seen throughout the pandemic and what that's really looked like for Kentuckians. And then we're going to follow up with a Q&A on what those changes have meant for Kentuckians and what we can do to ensure that these safety net programs like food assistance, unemployment insurance are available for Kentuckians when they need it. So today with me, I'm going to go over our three fabulous panelists that I'm happy to have here today. First, we have Kate McDonald with the No Kid Hungry. She's our No Kid Hungry campaign director with Feeding Kentucky, and she works to enhance food security for Kentuckians' youngest citizens through statewide food security initiatives. We also have Joseph, who's the research director of the food assistance team with the Center on Budget and Policy Priorities. And then followed by Dustin. Dustin Pugel is the senior policy analyst with KY Policy, who I work closely with, and I'm happy to have here today. So with that, I'm going to go ahead and get us started. I'm very excited to hear from all of our panelists today, and we're going to get started by turning it over to Kate McDonald.
Thanks so much, Jessica. I'm going to share my screen. Okay, great. Well, thank you so much for having me here today. As Jessica mentioned, I'm Kate McDonald. I work at Feeding Kentucky, and I manage the No Kid Hungry Kentucky campaign. It'd be helpful if I started the presentation, huh? Okay, so Feeding Kentucky is the state's largest anti-hunger network. We represent 7 member food banks, but also many partners across the state. Today, I'm going to talk to you a little bit about who we are, what child food insecurity has looked like, the impact of COVID, and a few other updates about programs that have changed because of COVID and the nature of feeding. So these are member food banks. Sorry, can you still see that? Apologies. Okay, sorry. These are member food banks. Like I said, they cover all areas of Kentucky, and there are 800 food pantries within our food bank service area. The No Kid Hungry Kentucky campaign is a partnership between Share Our Strength and Feeding Kentucky. And the key strategy is to make sure that kids have access to meals every day, 3 times a day. So that is through school meals, summer meals, and after school meals. And the way we go about this is looking at training, resources, and advocacy. Feeding Kentucky and Share Our Strength have given over $1.2 million in grants to partners since March 2020. And we've been advocating on the federal and state level for changes that make sense for Kentucky kids, Kentucky sponsors, and Kentucky families. So we're going to take a quick look at what child food insecurity has looked like over the past few years. And first, let's talk really quickly about what food insecurity is. Food insecurity is USDA's measure of lack of access at times to enough food for an active, healthy lifestyle for all household members and limited or uncertain availability of nutritionally adequate foods. Food insecure children are those children living in households experiencing food insecurity. So this is the food insecurity rate in 2018. You'll see here that the rate was 18.9%, so just over 190,000 children in Kentucky. You'll see that there is a larger grouping in this eastern part of Kentucky that has a significantly higher rate, 30% or higher, so close to 1 in 3 children. But those are not just the places to focus on high food insecurity. You'll see throughout this whole central corridor, a lot of the food insecurity rates reach between 20 and 29%. So well over that 18.9% rate. So let's talk about what the impact of COVID is. These are the 2020 projections of child food insecurity rates. You'll see that it is 21%, which is actually much lower than what Feeding America projected at the beginning of the pandemic. They projected as high as 26.8%. So 21%, while definitely not good, much better than initially projected. And you'll see if we do a little comparison, some of these eastern counties have significantly higher food insecurity than they did in 2018. But also too, some of these central areas moved from the 18 to 20% range to a much higher 24 to 30% range. And if you want to take a look at the difference between 2019 and 2020, you'll see that in actuality, not as many counties increased food insecurity, but it's also important to consider a lot of these counties had significantly high food insecurity rates to begin with. So if we're talking about food insecurity that's over 30% pre-COVID, those rates, to get much worse, it'd be difficult to get much worse than that. So you'll see up here towards more the northern central area around Lexington, Louisville, and up near Covington, that is where that change in increase we saw in particular in 2020. So this is the projected insecurity rate for this past year. You'll see it is actually it is several points lower than that of 2020, which is a good sign. We think that, the safety net, while not absolutely perfect, did help prevent that huge growth like they predicted in early March 2020 at the beginning of the pandemic. We were thinking 1 in 4 kids versus 1 in 5 kids, and it's looking like while the rate is looking more around 2017, 2018 percentages, that is, again, significantly better. But if we're talking about number of kids, that's still around 190,000 kids that don't have adequate meals to live a healthy, active lifestyle. Okay, so obviously we know that COVID has impacted a lot of the way we operate just from day to day. And that's the same for a lot of these child nutrition programs that help feed Kentucky kids every day. So a couple of the questions that I am thinking about and many activists are thinking about are, 1, how do we feed kids when they're not in school? 2, how do we address increased food insecurity and tight budgets? And 3, what have the changes we've made since COVID started taught us? And that third piece is particularly important because actually the changes that have been made in some of these programs because of COVID may be something that we want to look at to make permanent. In particular, USDA had many child nutrition waivers for the summer food service program. And I know that's kind of confusing because you think, obviously, that's just a program that happens in the summer. But in actuality, that program has always been available for emergency feeding. So for example, if there was ice or snow and kids were out of school, schools have always been able to serve kids meals through this program. So that is actually the program that jumped into place when schools were let out in March of 2020. But however, the summer food service program, if you're familiar with it, a traditional summer would look like going to a site, eating one meal. A kid would go to a site, eat one meal, and then leave. And then if they were coming back for another meal, they would go back to that site and eat a meal again. Obviously, that model does not work in the time of COVID. There have been many waivers, over 100. I do not have the time to talk about every single one of them. I know we all just ate, so that'll put everyone to sleep. So some of the things that I find most compelling and important. 1, the congregate feeding rule. So that is the rule that requires kids to eat on site. That has been waived, and that has getting rid of that congregate feeding rule has significantly impacted the amount of kids that are able to eat these meals. Looking at the congregate feeding rule, loosening that rule has been something that Feeding Kentucky has been advocating for many years now. And what has been interesting about COVID is that it's really been able to help us see what the program could look like if that rule was loosened. The second that I find particularly interesting is, and many of you may have experienced this or know about it, is that kids were able to take home more than 1 day's worth of meals. Just thinking about accessibility, that has been really helpful because families don't have to come back once or twice a day, every day of the week, to make sure their kids are having access to a healthy meal. That has been really a game changer for families, but also for service providers. The people that are making these meals, it has made it a lot easier to streamline and make sure as many kids as possible have access to healthy meals. So what does that mean for this past school year? So I won't get too far into details, but Seamless Summer Option is a program that's very similar to SFSP, the Summer Food Service Program. And actually school meals have been operating through Seamless. And these waivers, like I described, are really only available till the end of June of this year. So that really creates a bit of urgency, in particular for sponsors that are serving kids meals this year in the summertime, because they will have to change, if that waiver doesn't get extended, they will have to change the way they are serving kids this year during the summer. So we are hoping that USDA extends that waiver at the very least through the end of the summer. So, this would mean that kids could, in the month of June, could pick up a meal, could pick up 5 days worth of meals and go home. And then starting July 1, we'll have to go to a site and eat on site. So that is a lot of disruption for families and also for service providers. So looking forward to summer 2023 and beyond, we are really hoping that some of the lessons we've learned about SFSP can be implemented and changed permanently through USDA, in particular loosening the congregate feeding rule, because it makes sense in particular for a lot of our sponsors in Kentucky that are in hard to reach areas, trying to reach families that live far away from a school or a site, trying to reach kids. The sponsors should be able to make the right choice for their community. And we believe that, loosening that congregate feeding rule is the answer to that. So the second thing that has come about because of COVID is PEBT. PEBT, or pandemic EBT, is grocery benefit designed to reimburse families for meals lost due to COVID-related disruption to childcare and preschool. Now, the thing that I don't have tons of time, but I want to really touch on this question of what have we learned. Summer EBT, very similar to pandemic EBT, has existed before COVID, and it functioned in a similar way. When school is out of session, kids and families lose access. Some families lose access to frequent free meals for their children. And the summer meals program is vitally important, but the reality is that it will never be able to reach every single child that needs it in the state of Kentucky. So the idea that in the summertime, a family could get reimbursed for meals lost because their kids are out of school is really revolutionary. And I think that we are hoping that something like a summer EBT could be made into a full-time program, not just as an emergency in reaction to the pandemic. I think Kentucky has learned, our fellow advocates and also our state agencies have learned a lot about how that could function. And we would hope that something like summer EBT could become codified and actually happen every summer in conjunction with the summer meals program. Another thing that has become a really interesting topic of discussion amongst advocates all over the country is universal meals or school meals for all. Now, there are many benefits of offering, so I'll back up just a second. So kids this year and also this past school year have been receiving free school meals for all through the SFSP last year and SSO this year. So there are many benefits. One, reducing or eliminating stigma. It's significantly less paperwork for school nutrition and staff. It's streamlined. And at the end of the day, it means more kids will have access to meals. So there are a couple ways that this could actually happen. First is through the community eligibility provision. The second is through provision 2, and the third is through locally funded universal school meals. So the thing that I've been thinking about, and I've been talking with Jessica and others, is what could actually be feasible for the state of Kentucky? Well, what could actually work in our state? California has implemented a universal school meals bill, but obviously Kentucky is very different than California and has different access to different pots of money. So the first thing I wanted to highlight is that Kentucky is actually doing incredibly well and participating in things like that would increase access to meals. So CEP, the community eligibility provision, of all the schools that could participate, 98.6% of Kentucky schools are. So that means that we have almost complete compliance with this very optional but really important program. So I think that is something to celebrate for Kentucky, because schools are recognizing the importance of making sure that all kids have access to meals, and they are choosing to participate in a program that is not required. There has been talk, in particular this past fall in the discussions about Build Back Better, about changing the threshold that would impact community eligibility. And some of that change would actually almost make every school in Kentucky eligible to participate in CEP. So that would be a really incredible and free option for Kentucky. And so I think that's something that moving forward, Feeding Kentucky is definitely going to be talking more about and looking at, because that would impact several districts that are unable to participate right now. The really hot ticket item is talking about state funding, local funding for universal school meals. In Kentucky, Feeding Kentucky has estimated that would cost between $48 and $53 million a year to implement in the state of Kentucky. So while we absolutely believe in universal school meals, that is quite a lot of money for the Commonwealth. So, I think as Feeding Kentucky, we are thinking about, we know that school districts are willing to participate in programs that increase access. So how can we optimize those programs and make them more accessible to other districts as well? That seems like the most feasible path forward when we're thinking about opening up more school meals for kids in the state of Kentucky. This is my contact information. I'm right on time. The other thing I wanted to mention too is that, food banks in Kentucky have seen a significant increase in people needing the help of food banks. And while food banks are a critical piece of the puzzle in food security and food access, the safety net is really what is holding up and bolstering all of these people. Without access to healthy meals at school, without things like SNAP, without things like PBT, and other things that our other panelists will be speaking about, the work of food banks really would be impossible. So I think that's just, I think if you take away nothing else, I think you should take away that food banks, while important, without these federal programs, it would be impossible for them to function in the way that they do now. And on that note.
All right, I think I'll jump right in here. Let's see, share my screen. All right, can everyone see that? Great. Yeah, thank you, Kate. That was excellent. My name is Joseph Llobrera. As Jessica mentioned, I'm from the Center on Budget and Policy Priorities. We're a Washington, D.C. based research and policy institute that advocates on behalf of all the programs that we're talking about today, the safety net programs, and making sure that low-income families and individuals in this country have access to the supports they need when they need them. So I'm here to provide a national perspective on food assistance during the pandemic. We don't have official data for 2021 yet, but in 2020, food insecurity held steady when you average across all households. I think Kate's presentation kind of previews some of these national trends. 1 in 10, that is 10.5% of US households was food insecure in 2020. That meant that nearly 40 million individuals living in about 14 million households had difficulty at some point in 2020 getting enough food due to the lack of resources. The overall rate was unchanged from 2019. And like Kate said, that when we were faced with the surge of need in early 2020, it seems surprising that we would end up in this place looking back with the data that we have now. So yeah, we can see that on the left-hand side of this graphic. Light blue is for 2019 and dark blue is for 2020. And yeah, it's really a testament to the impact of the relief response, including enhanced food assistance, that food insecurity did not get worse in 2020, even as many of us were bracing for kind of worst case scenarios, historic kind of hardship. And without government action, charitable relief, and just communities and families stepping in for each other, food insecurity would have been much higher during the pandemic. But as we know, the loss of life, the loss of jobs and income during this pandemic did not fall evenly across everyone. Looking beneath the surface of the top line figure, we'll see that there was troubling news. 3 million more individuals experienced food insecurity in 2020 compared to 2019. So, more research needs to be done, but one hypothesis is, housing instability, people were moving in to, combining households. And so even if the rate of hardship hadn't changed, more people were still experiencing food insecurity. The number of children who were in food insecure households rose by 1 million in 2020. 1 in 7, that's the 14.8% here on the right, 14.8% of households with children were food insecure in 2020. And that was up from the 13.6 in 2019, as you can see on the right-hand side over here. All right, so due to long-standing inequalities and inequities that were, in many ways reinforced by this pandemic, hardship is especially high among households of color. Here's a time series from the past 2 decades. The blue line you see kind of in the roughly in the middle is the food insecurity rate for all households. The red line towards the top is the rate for households headed by a Black respondent. The orange is for Hispanic households. That's a terminology that the Census Bureau uses. And the gray line is for white households. As you can see, the disparities between Black and Hispanic households versus white households, those disparities have been persistent over the past 2 decades. And I'm gonna go back 2 decades because that's when the US Department of Agriculture started consistently collecting this data. And those disparities widened in 2020. As you can see, the red and orange lines shot up while the line for the gray line went down. So in 2020, Black and Latino households were more than twice as likely to experience food insecurity as white households. So back to the theme, a lot of relief flowed out from federal nutrition assistance programs during the pandemic. There was the creation of the pandemic EBT program that Kate described earlier, to replace meals that children were missing when they shifted out of school. SNAP emergency allotments that brought everyone up to the maximum SNAP benefit level. Initially, that was the interpretation under the Trump administration, and then that was revised under the Biden administration to make sure that those that were at the maximum level got at least $95 more per household. So the initial interpretation of that provision left those that were most in need, the ones that were already receiving the maximum, they didn't see anything, any additional assistance. And so the revision made sure that everyone got at least $95 more in SNAP assistance per household. Then there was a temporary 15% increase in the maximum SNAP benefit. That was in effect from the start of this year. No, we're not that year anymore. Start of 2021 through September of 2021. Right on the heels of that, a permanent 21% increase in the maximum benefit in SNAP took effect in October, and that's in effect now. And I'll show you a little bit more about the interaction of these provisions in a short while. Other things that impact access: the suspension of the time limit for non-elderly adults not living with children, that is suspended during this public health emergency. There were also investments in WIC and operational waivers in SNAP and WIC, and as Kate explained, other programs to make sure that people had the access and could stay on these programs during the crisis. So I wanted to turn to this, this graphic here. As many of you know, after unemployment insurance, SNAP has been the program that's most responsive to the rise in need during and after economic downturns, and this pandemic was no exception. The graph here shows how the national and Kentucky SNAP caseload changed compared to where it was just before the start of the pandemic, so in February 2020. It doesn't show the actual caseload, it shows change relative to where we were before the pandemic began. So if you ended up at 0 on the vertical axis, that means your caseload hadn't changed since February of 2020. Any vertical rise in the line means that it has grown since February 2020. So yeah, in Kentucky, SNAP responded quickly in Kentucky, as you can see, in the spring and summer of 2020. Caseloads at one point, I think around May, June, had risen by over 35% compared to just a couple of months earlier. It kind of decreased in the summer of 2020, but then picked up again in the fall of 2020 and winter of 2020. Stayed kind of high, kind of at that level, and then it started to decrease since this last summer. We haven't had a chance to really dig into each state's caseload trends, but I would be curious to see if anyone attending has some thoughts on what's driving the decrease in SNAP caseloads. Is that an access issue? Is that improvement in terms of the local economy? I'd love to hear what your thoughts are on that. So yeah, with the latest data that we had, which was in the fall of last year, Kentucky's caseload had come down, but it was still about 8% higher than where it was before the pandemic started. In WIC, I wanted to turn to WIC. So Kentucky was also relatively successful at reaching people through that program, through WIC, during the pandemic. As you can see, nationally, actually, we were surprised to see that caseloads in WIC hadn't changed all that much, kind of stayed relatively, didn't grow much compared to pre-pandemic period. But there are theories about why that was the case. People were getting a lot of other assistance from other programs. So while significant and important in terms of the health of mothers and young children, there were a lot of other resources that were available to them at this time. And the other thing is, depending on where you are in the country, you were sometimes required to come into the office to get your WIC voucher and come in to get the nutrition education that was part of that. So, but again, I'm curious to see if anyone has insight on what happened in Kentucky. Kentucky, the caseload grew quite dramatically. It's one of the few states that saw dramatic growth in WIC during the pandemic. It went up substantially through the summer of 2020, remained pretty high the fall and winter of 2020, came down in early 2021, but it started to kind of climb back up in the latter part of last year. All right, so a little bit of a busy graph here. It's the USDA's. I'll walk us through it in a moment. But as many of you know, there was a permanent change that occurred to SNAP benefits, and that took effect in October of last year. Maximum benefits are pegged to something called the Thrifty Food Plan, or the TFP. Super wonky model, basically. It's this black box model that USDA uses to figure out, the cost of a pretty frugal but nutritiously adequate diet. So USDA finally took a long, hard look at the Thrifty Food Plan and confirmed what many of us already knew from decades of research, stories, and experiences of people that are participating in SNAP, that the benefit levels were not enough to support a healthy diet. So they revised the Thrifty Food Plan which resulted in average benefits increasing by nearly 30%. That's a long-term permanent change that's not dependent on the pandemic response. So the height of this line graph is USDA's calculation of the average monthly benefit per person. So moving from left to right, we start with the pre-pandemic period, if anyone can kind of remember when that was. At that time, average monthly benefits were $121 per person. Then the pandemic hit. To address rising food hardship, as I mentioned earlier, SNAP benefits were increased through emergency allotments, which brought everyone up to the maximum benefit, at least initially. And then in January of last year, maximum SNAP benefits were raised temporarily by 15%. And then in April of 2021, the Biden administration revised that emergency allotment policy so that those that were at or close to the maximum received at least an additional $95 per household. So those combined resulted in average benefits rising, basically doubling to $240 per person per month. And then here's where it gets a little bit complicated, but please stay with me. Let's focus on the red line, the lower line. This is what would have happened without this thrifty food plan reevaluation. The 15% increase expired at the end of September, leaving only emergency allotments, and that dropped average monthly benefit amounts to $215 per person per month. When the emergency allotments expire, average benefits drop even further to $133 here on the bottom right-hand corner of that graphic. But with the modernized TFP, with this revamped TFP, we're actually on the green line, the higher line. Average benefits are $251 with emergency allotments. And I think that's kind of the situation with Kentucky still having the emergency allotments in place. But hopefully when this public health emergency ends, there's that, we'll be thankful for the pandemic to hopefully end someday. But that also means that these temporary assistance, it's going to be a big cut for a lot of households. We go from $251 to $169 when those emergency allotments end at the conclusion of the public health emergency. So now, while 169 is 30% higher than the 133 we would be at had we not had this thrifty food plan revision, it is a big drop from the average of 251. So that's something that policy people like me kind of thinking about the interactions, like we are in a better place, but the reality is people that are in need, that are relying on SNAP and other resources to kind of make ends meet, we need to prepare them for this eventual cut down the line. All right, so I wanted to tie it up here so that we can hear from Dustin in just a minute. But there are a few other longstanding SNAP policy issues that I'll just touch on briefly. First, and Jessica's comments earlier previewed this, protect the program. Here in Kentucky, Jessica talked about House Bill 3 from a few years ago that would have drastically restricted access to SNAP as well as other health and cash assistance programs. If I'm not mistaken, you all removed the SNAP drug felony ban last year. So that was, a huge kind of equity win in this state. But then you also had a ban tied to the child support cooperation requirement of SNAP that passed last year. So there's a lot of work to be done to make sure that SNAP remains accessible to those who are eligible for that assistance. So while SNAP is in many ways a very effective program, and often one of the few programs people can access when their income drops, more still needs to be done to reduce the administrative hurdles that applicants and participants often face that keep them from participating or staying on the program. There's a reporting requirement, a renewal process, and a lot of households kind of drop off of that, not because they don't need the assistance anymore, but they may not get the notice saying that their benefits are expiring or the process is too cumbersome and complicated. And while SNAP is broadly available to low-income people, there's still some groups that are excluded from the program. As I referenced earlier, SNAP has a 3-month time limit that limits individuals ages 18 to 49 with no dependent children to just 3 months of SNAP out of every 3 years, unless they're working in a training, unless they're working or in a training program for at least 20 hours a week. This harsh policy cuts people off even if they can't find a job. And this group is the one that often faces many barriers to work. Now, while this time limit has been suspended during this public health emergency, it will, when that public health emergency ends, that harsh time limit will come back. And then rules for non-citizens and mixed status households are restrictive and can be quite complicated. The Trump administration also took a number of actions to discourage and to instill fear in immigrants from accessing programs like SNAP, all of which result in many in this group not being eligible for, or even if eligible, not getting the benefits that they need. Many low-income higher education students face difficulty affording food. And there, again, the rules can be quite complex and bar many from SNAP, although recent legislation have relaxed some of those rules during the current pandemic. So in short, there's a lot of evidence that SNAP is a very, is a critical program to, shore up our nutrition and food needs. But there's still a lot of room for improvement to make sure that the program serves the people who need it and the benefits are enough to meet their needs. And so with that, I will turn it over to Dustin.
Thanks, Joseph. I will go ahead and share my screen here. When we talk about the safety net, I think there's a lot of programs that we could discuss. I think for the purposes of today, focusing in on SNAP and unemployment insurance makes a lot of sense because in a lot of ways, these two are sort of I think of as the two pillars of our anti-recession toolbox. Both SNAP and unemployment insurance have really strong anti-recessionary effects because for every dollar spent through these programs during a downturn, you generate close to $2 in broader economic activity. So there's all kinds of really good data to show that not only does SNAP alleviate hunger, it also actually helps keep people in their jobs because of the way that it supports local economies. So having said that, I'm really excited to talk a little bit about what has been happening with unemployment insurance over the last 2 years and kind of where we think unemployment insurance is headed post-pandemic. So again, my name is Dustin Pugel. I work with Jessica. I'm Senior Policy Analyst with the Kentucky Center for Economic Policy. And so I'm going to jump right into it with a quote from a really good report called 7 Lessons We Learned from the COVID-19 Pandemic and Unemployment Insurance, written by NELP, which is the National Employment Law Project. In it, Amy Traub said, at the height of the COVID-19 unemployment crisis, roughly 1 in 6 US adults, about 40 million people, received unemployment insurance benefits. Access to unemployment insurance reduced the official poverty rate from 12.9% to 11.4%, preventing 4.7 million people, including 1.4 million children, from falling into poverty just during 2020. At the same time, the rush of pandemic claims exposed the poor condition of the state's unemployment insurance infrastructure. So that's a lot of national data in that particular quote, but I think the same thing is absolutely true for Kentucky. Unemployment insurance was a game changer in terms of keeping people sort of above water during the pandemic. That includes kids, and that it also means that we learned how bad our unemployment insurance infrastructure had crumbled over the last 40 years. Our unemployment insurance staff were working off of a computer system that was originally designed when Richard Nixon was president. And it was the same computer system that we worked with to process an unimaginable number of claims during 2020. And it's frankly still the computer system we have today until we're able to build a new one. And so I think we've learned a lot over the last couple of years. And one of the most important lessons I think we've learned is what a very large boost in federal funding for unemployment benefits can mean. So this chart, I think, is really remarkable. This shows the number of continued jobless claims in Kentucky between March of 2020 and all the way through the end of 2021. Now, continued claims are folks who didn't just ask for benefits. They're folks who received at least one check and then asked for a second one. So these are not, this sort of pulls out a lot of the fraudulent claims that were never actually made. It pulls out unfortunately, a lot of the claims that were legitimate were not made because our unemployment system was slow to respond. But this was truly just a tidal wave of need in Kentucky. We went from roughly 15 to 20,000 claims a week to well over 200,000 claims a week. And then it slowly but surely sort of whittled down to where we are today, which is actually below pre-pandemic levels. This took several different forms. It wasn't just sort of our traditional state unemployment insurance program, which we've had since the FDR era, which was a significant portion of it. In fact, it's that dark blue line, and comprised about $1.6 billion over the course of the last 2 years. But it also included something called pandemic unemployment assistance, which was the special federal program for folks who are not traditional employees. They're gig workers. They're folks who lost work because of the pandemic, and was actually patterned off of a longstanding federal program called disaster unemployment assistance, which we're using right now in Western Kentucky for folks who lost their jobs because of the tornadoes. In addition to that, there was pandemic emergency unemployment compensation, which was a special program for folks who ran out of their regular state unemployment insurance benefits. And then on top of all that, there was a special program that was really designed to help make up the gap that is left through traditional unemployment benefits between how much folks were earning and what they receive in unemployment benefits, which is typically about 50% of lost wages. And that's called the federal pandemic unemployment compensation. During the downturn, we called this the extra $600 a week. Sometimes it was called the extra $300 a week after, through much of 2021. And that was really where most of our wage replacement came from during the downturn. It comprised $4.3 billion in Kentucky. So all this together really made up a not insignificant share of Kentucky's GDP, which meant that it helped continue demand so that people could continue to buy things they need, which also meant that the folks that they were buying from could continue making and selling the things that they needed. So EPI during the depths of the downturn estimated that just that extra $600 a month alone kept about 50,000 people at work because of its anti-recessionary power. Speaking of which, I already mentioned that SNAP and UI are sort of the core anti-recession, anti-poverty programs when it comes to fighting off downturns, whether that's a widespread downturn or even just a downturn in a household. From studies that preceded the pandemic, we found that about 18% of the hit to GDP was avoided because of unemployment insurance during the Great Recession. And that was before there were extra benefits. That's before there was PUA, that extra program for sort of non-traditional employees. So it's likely that GDP was propped up even more during the COVID downturn because of the incredible work that they did on the federal level to ensure that we had these programs. Those boosted supplementary benefits, as folks may remember, were the subject of a lot of controversy and consternation. There was a lot of talk about how these benefits were keeping people from taking jobs. Research has shown, though, that those boosted and supplementary benefits, while they did lead to an increase in spending, which was good for, again, making sure that not only was their livelihood kept to a high standard, but also keeping other people in their jobs, it also led to no change in work searching compared to before the pandemic. Which is really important and I think also pretty obvious when you look at what happened once those benefits expired, both in states that cut them off early in the middle of 2021 and for the rest of the states when those benefits went away in September. There was not a rush to employment like there was some prediction around. And so what we know is that while these extra benefits did alleviate hardship, they did not change people's behavior when it comes to employment. What it did do, though, like I said, was greatly reduce hardship among individuals. So this table on the left is a report that BLS did that compared folks who applied for benefits and received them versus those who applied for benefits and did not receive them. And again, unfortunately, just due to the sheer volume and decrepit nature of our unemployment insurance system, a lot of folks who did not receive them were owed them and just did not get them in time or did not get them at all. So among those who received them, though, it reduced their difficulty in affording household expenses. It reduced their food insecurity. It made sure that they could stay current on their rent. It made sure that in terms of sort of health outcomes, it reduced their anxiety and depression, which, as you all can imagine, not having any source of income would certainly increase my anxiety and contribute to some depression. So ensuring that there was some wage replacement during the worst part of the downturn had really profound effects to help people. So in terms of state policy, though, what is coming up in the General Assembly? We know of at least 2 bills that have been discussed that we anticipate seeing filed, and the jury is out on how much traction they will gain. The first is on something called short-time compensation, STC for short, sometimes called work sharing. This is a special program that the majority of states, not including Kentucky, utilize that helps keep folks on the job and helps continue sort of a strong attachment to employers. So typically, in order to qualify for unemployment insurance, you have to be laid off through no fault of your own, lose connection to your employer, and then apply for benefits. Work sharing is a different program wherein if an employer thinks that they can reduce your hours, they can simply give you less time at work and then through a managed process, work with the labor cabinet to provide unemployment benefits to make up part of the difference that you've lost in your hours, which means that you get to keep your retirement plan, you get to keep your health benefits, and you get to keep your job while still receiving some supplementary benefits in the meantime. It's an incredible program during the worst of the pandemic, when everyone who was talking about unemployment insurance were getting calls from people asking, how do I get help? I got calls from employers saying, hey, I filled out my STC application with all the states around you all, but I can't find yours. Where is it? And I had to tell them we didn't have one. So it's an incredibly popular program, both for workers and employers, because it helps to make sure that there's consistency throughout a downturn. Another is a good cause reason for separation from employment when fleeing intimate partner violence. I see some friends on our attendee list who are working on this bill. Again, to qualify for unemployment benefits, you have to be laid off through no fault of your own in order to qualify for those. You cannot voluntarily leave your employment and then receive these benefits, including if you are fleeing domestic violence. 39 other states, DC, Puerto Rico, and the Virgin Islands, they have this as a good cause reason for separation from employment that would qualify you for unemployment insurance. So we are in the minority handful of states who do not allow this to happen. And it not only creates problems for economic problems for women who do flee, there's some reason to believe that because economic dependence is a reason why women stay in, or people in general stay in abusive relationships, it could actually increase hardship for people experiencing intimate partner violence at home. There's also conversation happening right now around improved employer contribution processes targeted to solvency. That's just a fancy way of basically saying we pay for benefits out of an unemployment insurance trust fund, and that trust fund has gone dry 2 downturns in a row. And so part of the reason is that we have a system of employer contributions to that trust fund that don't work well in creating solvency. They ask more of employers during a downturn and less of employers when things get easier, when the economy gets better. And so there's some conversation around working toward a solvent unemployment insurance trust fund by changing employer contributions. While there is some conversation around that, there is more conversation in Kentucky right now around potentially harmful legislation related to unemployment insurance. The first is what's called indexing the available weeks of benefits. So right now in Kentucky, if you apply for unemployment insurance in a normal time, which functionally it is normal right now in Kentucky for unemployment insurance, even though we are still very much in a downturn and a pandemic, you receive 26 weeks of benefits. So that's roughly half the year. And that's the standard that the US Department of Labor suggests. That's the standard that has been in some federal legislation recently to mandate, but not all states do that. Some states have fewer weeks and some states have fewer weeks that adapt to the unemployment rate. So something that has been suggested during the interim through the Unemployment Insurance Reform Task Force is reducing the number of available weeks and then raising that when the unemployment rate goes up and lowering it when it goes down, or other way around, actually. So that's a problem, though, because first of all, 26 weeks should be a floor for the number of weeks that people have benefits available to them, not a ceiling. It takes a while to find work that is suitable. And second of all, we've found through research that folks who are pushed into employment early because of less generous unemployment insurance benefits tend to get jobs that pay less and are a poorer fit for their skill sets, which not only hurts them immediately, it hurts their lifetime earnings. And so what you end up with is a lower paid workforce with mismatched skills. And that not only hurts them because they lost their benefits early, that hurts them because their income will then suffer moving forward, because we know that folks' income is usually based off of prior income history. So that is a really concerning policy proposal that's been put out there, and one that we are keeping our eyes on. Another is increased work search requirements. So in order to continue to qualify for benefits, you have to prove that you're out in the workforce asking for work. And you have to get suitable work, which has specific guardrails around it to make sure that you're not an engineer going to work at Starbucks. States like Florida and North Carolina have stricter work search requirements, meaning lower wage thresholds prior to your previous wages, and also requiring that they ask more employers per week and prove that they've done that in order to keep their benefits. The same things apply to this situation as indexing weeks. Its main result is to push people into lower paying jobs that are not as good of a fit for their careers, resulting in lower lifetime earnings and less job security. The last is reducing employer contributions through tax cuts. There was a tax cut bill last year, which ended up not being necessary because we no longer had a loan. We used our ARPA money to pay off that, which is a whole other conversation we could have. Happy to get into that in the Q&A. But reducing employer contributions makes no sense right now, especially since solvency in our trust fund has been a huge issue over the last two downturns. It also doesn't make sense because employers now pay less in unemployment benefits than they have at any point in the program's 83-year history as a share of total wages. So further reducing that not only hurts our trust fund solvency, it also means that we're moving in the wrong direction in terms of adequate employer contributions. So I'm going to stop there and hand it back over to Jessica. I'm happy to answer any questions during the Q&A.
Thank you all so much. That was so insightful to hear each of you speak today. And I will kind of remind everybody you have the opportunity to put questions into the Q&A or directly into the chat, and we can answer those for the rest of the session. I know one that came up for me, Joseph mentioned in SNAP particularly some of the participation rates, and Dustin responded in the chat that we might have some ideas about that. So I want to open that up for Dustin and Kate. If you have thoughts, I know that I do, on some of the SNAP participation trends that we saw and what might be the cause of some of the most recent downturns. Would either of you be interested in responding? Dustin, do you have thoughts?
Yeah, I can just say briefly that in conversations with our state SNAP administrator, they had a really difficult time during recertification. So one thing Joseph didn't mention, but he knows full well, is that the recertification process was put on hold for a good part of 2020. That was one of the waivers that states, including Kentucky, applied for and received. So when it came time to go through the recertification process, which can be somewhat cumbersome for participants, we heard that there was a very low rate of response for folks who were required to do that. And so part of the reason I think we saw a sharp drop off and why we're seeing a slight rebound in recent months is that there was people were very slow to recertify their benefits, and now that it's not coming off the heels of a 6 or 8 month hiatus, I forget how long it was. I think folks are getting more into the rhythm of going through that process. Is that kind of what you, Kate, and Jessica would think is a reason why there was a quick decline?
Yeah, that's my first thought. So I don't really have too much more to add, but that makes complete sense to me.
Yeah, I would say definitely the recertification periods is something we've been seeing. And then I'll also add, I know that the call line times right now are about 2 hours long, and right before the pandemic, they were closer to 5 minutes. So, and at one point during the pandemic, they were at 5 minutes too. So I know that that's another barrier for folks right now that our Department for Community Services is working on mending.
Can I ask a follow-up?
Mhm.
What's the situation with in-person office access in Kentucky these days?
So variable. A lot of our offices are currently open to in-person appointments if you make an appointment ahead of time, which we know has barriers for some people who don't necessarily have easy internet access. Yeah, so I'm sure we'll see more changes as operations change in reflection of the pandemic.
Can I ask a
Of
question?
course.
We were curious about if you have any insight on the WIC participation increase in Kentucky, because it's more of an outlier compared to other parts, other states where it seemed like it wasn't really budging. So I don't know if you had any insights on what was happening. Was it a demand thing, or was access? Yeah, I'm curious if you have any thoughts on what might be the reason for it.
Definitely curious to hear what Kate and Dustin have heard as well. But I know in relation to that, our cabinet has been working on some of the modernization efforts that we've seen in other states, things like making telehealth appointments and being able to minimize those in-person visits. So I know that has made a big impact for people. I know that our participation rates are still highest in the children under, I think it's under 1, the very youngest children that participate in WIC. So that remains true from what I understand. Dustin or Kate, do you have thoughts on that?
Yeah, I'll just amplify what you said, Jessica. I think the accessibility piece, the telehealth piece, not required, similar to the school meals, not requiring families to have to go to many appointments or many things throughout the day, has really opened up some doors for families that previously didn't participate in WIC because of those time barriers.
Well, with that, one other thing I wanted to mention was we heard, I think, a few examples of success stories and things that have been working well, like for WIC, for example. I know Kate and Joseph, you both talked a little bit about what Kentuckians are experiencing in terms of food insecurity. And I know Kentucky's picture kind of reflected the national picture as well, but I'm wondering if there's things you've heard in other states that are maybe pilot projects or innovations that have worked well. I know, Kate, you've talked a little bit about congregate feeding and how ending that might be a good thing, and delivery of meals. And what are you thinking in terms of what other states are doing that has worked well?
Well, I can start. Well, One thing that's been in the press in the last week was just talking about pandemic EBT, right? This is think about households with kids that are faced with the loss of the enhanced child tax credit that ended in mid-December. This is the first month that is no longer in effect. Thinking about, I think, Jessica, you told me that Kentucky has applied for the pandemic EBT for this school year, but yeah, that's not to discount the challenge, like the administrative challenges in kind of implementing that program during a time where in-person versus virtual is quite variable at a sub-state level, at a very local level. But yeah, there's only 8 states that are currently approved for that program for this current school year. I think maybe a dozen or so more that are in the process of applying or being considered by USDA, but that's a huge gap that those dollars are being left untapped when a time when families with kids are seeing other resources dry up. The other thing, I think, heard good news from you all that the emergency allotments continue to be in place here, with, I think, a bit of a tussle at the legislature about pushing that public health emergency declaration out a little bit further. But yeah, we've seen a number of states roll off of that, and as comment in the chat you all put in there, there's a lot of food assistance flowing through that temporary assistance, and we know that from the last recession, it took like a decade for food insecurity rates to kind of get back to where they were. There's a long tail to the hardship, even if broader indicators say otherwise. And so thinking about making sure that each state makes that assistance available until it's absolutely no longer possible to make those and get those out the door. So those are the 2 things that come to mind. But the other thing is we're trying to get a gauge on is this access question, as hopefully someday we move to a non-pandemic context or something closer to where we used to be, making sure that people still have kind of access to caseworkers, access to agencies to sort through, because these are complicated programs. And if people are waiting 2 hours and not getting through, what is their alternative, right? Making sure that Dustin shared the story about people running up against the brick wall when it comes to unemployment insurance. There's so much need that is not even showing up in our data because people are hanging out, people are not pushing those applications forth. So making sure that as we, I don't know, normalize is not the right word, but as we move to a new phase, that accessibility, people are thinking about that, because we were forced into virtual mode out of necessity, and to credit of a lot of states, we were able to kind of put up the PEBT program in those conditions, get these assistance out. But there are challenges if we remain, in terms of accessibility, if people are just relying on online or phone access to these services, because that doesn't meet everyone's needs.
Yeah, we saw that same thing with unemployment insurance. I mean, one of the biggest complaints was that they couldn't get anybody on the phone. They were sending emails. They weren't going anywhere. They just wanted to talk to a human. And so, we set up like 1 or 2 in-person days, and people brought camp chairs and started lining up at 4 a.m. And they didn't get to everybody. And so then we started doing in-person appointments at local workforce agencies. And those appointments filled up within 2 or 3 minutes of opening. And they would open up every morning at 9 o'clock, and by 9:02 they were full. And so then now we're talking about hiring new not social workers, but new UI workforce to staff those areas, because people just want to be able to sit down and talk with someone, because it's hard to trust an online interface that has failed you several times. And I think that's true for UI. It's been true in Kentucky for SNAP. And so it definitely underscores the need for sort of brick and mortar opportunities for folks to work through their benefits. One thing that I was on a UI advocates call with NELP the other day. One thing that some states are pushing for that Kentucky has in healthcare and maybe soon with SNAP is basically like a navigator for these benefits, someone who's out in the community, who may not be employed by the state, but who understands how to work through the process, maybe has some back end functionality with the system and can actually sit down with folks in the community and work through their UI claim to help walk them through that process. And like I said, that doesn't exist for SNAP in Kentucky yet. I know it's something that the state is working on and thinking about, but it would be really great to have that sort of person-to-person out in the community contact, rather than requiring that you show up to an office or call a number or log into a website.
Well, navigators sound amazing. And I know you mentioned both I think it was the good cause and short time compensation are common in other states. Were there other UI pieces or jobless benefits that you think are working well in other states? That's something we should be looking at.
Yeah, another one is what's called an alternative base period, which the details are so wonky, so I won't get into them, other than to say that you have to have really specific work history over the last year and a quarter, usually, in order to qualify for unemployment insurance. That specific requirement often leaves out low wage and part-time workers or workers with inconsistent work history who have maybe been laid off and then rehired at different points. So alternative base periods are basically a way of trying to capture those folks to make sure that they're not left out of unemployment benefits. And that is a system that nearly every other state in the union has implemented, and Kentucky is in the vast minority of states who have not done that. I think it's over 40 states have implemented an alternative base period. And it's not a difficult thing to do at all. It doesn't require a lot of administrative lift or even a lot of reprogramming. It really just requires statutory authority. And that's not something that so far the Kentucky General Assembly has seemed to have appetite for.
Thank you. So I know we've kind of delved into a lot of the policy pieces and what we would like to see change, but I'm wondering too if we can backtrack and Joseph kind of talked about even during pre-pandemic times, people needed assistance and they should be able to get it when they need it. So I'm wondering, Kate, if you can talk a little bit about some of the situations you've seen or heard about that people find themselves in that mean that they need food assistance or food bank services.
Sure. I mean, the way the population that food banks have seen over the past 2.5 years has changed. So I think Joseph mentioned there were 3 million additional food insecure people since the pandemic started, and in Kentucky we have really seen those additional people. We've had many people come to our member food banks and agencies that said, I've never needed food assistance. I've never needed to come to a food bank. And I think that has been that's been really surprising it wasn't surprising to our food banks per se, but it was, having so many people that were unfamiliar with how food assistance and safety net programs functioned. That has been something that we've seen a lot, in our school districts and other partners that have been feeding kids. We've heard very similar stories of, I think it's interesting that a lot of families didn't realize they were benefiting from programs like community eligibility. And so then when, school was out of session and realizing that, they were relying, a lot of families suddenly realized they were relying on programs that they were benefiting from that they weren't even really that aware of. Those meals served by schools and given out in the community over the past 2.5 years has also been really important for many people. We really see people from all walks of life, But that has been kind of one of the newer groups of people, are people that have never experienced any sort of food insecurity before.
Yeah, that makes me, I appreciate that, Kate. It makes me think of, there's a moment of learning that we can the data will tell us certain things, but capturing these stories and, because, while the pandemic revealed a lot of the inequities that some of us kind of knew were there under the surface, I think what you said, it revealed how much these programs, the potential for these programs to really kind of protect us in these difficult times. So people that didn't realize that these resources they were already, benefiting from them, or it was available to them. I think there is a lot of opportunity to kind of make sure we don't forget the lessons that we've learned and continue to learn during this period. So there's think about the qualitative research, the story collections, those kind of things that remind us at a visceral level, like the power of those images of people lining up for food assistance, right? I still get goosebumps just thinking about that, and just capturing those while we're kind of still close to that experience.
Yeah, and I think, Joseph, too, it also made us step back and think about how we're communicating to the community in general about, what we do and what food assistance is available to people. Having a lot of new people come to food banks makes you rethink your messaging. And I think it makes me think about, and when we're thinking about child nutrition, it makes me rethink, like, how can we kind of do some education about what's up? Because I think things like community eligibility is absolutely fantastic. And the fact that Kentucky is almost #1 in the country in terms of participation is something to be celebrated. But it's, in a good way, is almost seen as like, this is just what you do. But that's something that, we should be educating people more about why things are the way they are.
I think those are great positive notes for us to kind of wrap up on. So my last question is going to be, I think that image is implanted in our brains, all of the cars lined up outside of a food bank trying to get emergency food assistance, and all of the people trying to get an in-person appointment for UI, knowing that they can't figure out how to work it online, or not getting their answers called or their calls answered when they're calling offices. So what, maybe if you could just say like 1 or 2 things that we could do to kind of prevent that in the next pandemic or disaster moving forward.
I can start with UI because I think the answer's pretty straightforward, which is we've got to modernize our unemployment insurance technology. There's a lot we could do to improve benefits, and that needs to happen as well. But in order to avoid just an onslaught of need that's being unanswered, we've got to have a new computer system. We've got to have a new system of managing benefits on the claimant side, because I know one of the frustrations was that they felt like their claims just dropped into a black hole and never heard anything after that. So having some ability for claimants to see what's going on with their claims in real time will be helpful. And then we have to just invest in the infrastructure of our workforce system, which includes unemployment insurance. If we don't have the physical people there to answer phones, to deal with problems, to work especially difficult claims, to push back against fraud when it exists in an appropriate way, then we're going to end up with the situation we saw before. Another thing that I didn't mention that we also need to watch out for is resisting an over-calibration toward anti-fraud policy. There is a reality in which the pandemic saw an incredible amount of unemployment insurance fraud. And I say incredible because it was more than we normally see, and partially that's because there were more programs available and people were taking advantage of that. That created a very real temptation, I think, for lawmakers to then turn around and just go straight for program integrity and make it harder to get benefits, which they did in some ways. We now have the ID.me process that folks have to go through, which is very difficult for folks to use. There's some thought that it may even be more difficult for people of color to use because of the way that the camera technology picks up on different skin tones. And so you end up with higher levels of fraud accusations for people of color. So, there's going to be, I think, a lot of conversation during this General Assembly session and truly before the next downturn around making sure we push back against fraud that will only make it harder for everybody. And I think we need to make sure we appropriately calibrate and not over calibrate to deal with that. And that's not just true for unemployment insurance. I think the same thing is being discussed right now in Frankfurt around SNAP and other safety net programs.
In some ways, obviously not in all ways, but in some ways, the summertime is an emergency for many families because they rely on school meals. So that has always existed. And I think the thing that I hope for the most are, permanent changes to the SFSP SSO program on the federal level that would make it more accessible for families and for the people that are serving the meals. And then also summer EBT. Pre-pandemic, 1 in 10 kids that receive free or reduced price meals in Kentucky had access to a summer meal, which is a very low percentage of kids accessing meals. So I think that, the summertime really needs to be a focus because without that community hub of schools and without that, the financial burden is much greater. So helping families through additional money through summer EBT and making sure the people that are feeding kids actually can access them makes the most sense to me. So those are my two hopes and dreams for summertime. I think they are very possible because of, strangely, we've had about 2.5 years of, I guess you could call it a pilot of what that could look like.
I'll add 2 threads. One is maybe back to the accessibility thing, thinking about all the households in Kentucky that were able to get access to SNAP when they needed it initially. And, there was a lot of operational waivers that were in effect during this period. We need to take a look at how those played out in different states and different contexts to figure out, is there something to be learned about how we do our interviews, how we do our reporting, all of these requirements that create hurdles. They're there for certain reasons, but are we really making sure that these are considerate of the circumstances that people are in? So thinking about the lessons that we can learn from all of these upheavals in the way that these programs are operated. And then the broader thing that I'm reminded of, if you think back to that slide that I showed of the racial disparities in food insecurity rates, I mean, as a researcher who looks at food insecurity rates very often, and sometimes these numbers kind of wash over me, the fact that for some households, for households of color, where that rate has been bouncing around at 1 in 4, 1 in 5 over the past 2 decades. And why is that not a crisis situation, situation? If that was the rate for, frankly, white people, that would be a huge crisis. And so just a reckoning for all of us who work hard on this, like, it's one thing to be concerned about overall hardship. Yes, that's an indicator of need, but is that acceptable for year in, year out for 1 in 4, 1 in 5 households to continue to be struggle to get food, which is an indicator of other needs in their lives. It's just a kind of wake up call that I don't want to forget coming out of this experience.
Thank you so much, Joseph. That was a really powerful note. And I think that is important for us all to remember, that that's why we do this work, to defend the safety net, and how important it is for families that are using it. And it doesn't matter what kind of disaster or emergency it is, because it's an emergency to them. So I just don't see any additional questions in the chat or in the Q&A. So I just want to say thank you so much to our three panelists. It's been brilliant having you on today to discuss these really two important aspects of our safety net. And I definitely learned a lot today, and I hope that all of our attendees did as well. So thank you so much. And with that, I invite everybody to join us in the next session, which is our keynote speaker. So hope to see you there, and thank you.
Thanks, everyone.